This Medical Minute sponsored by Avera.
Well, you know, as we get older, taking care of our bodies becomes even more important.
Yes, it does. Dr. Leah Prespo, a family medicine physician with Avera, joins us with some tips on staying healthy as you age.
You know, as everyone ages, women and everybody else, right? We want to make sure that we're making proper dietary choices, staying at a healthy weight as much as possible. And those kind of things really help to reduce your risk of developing chronic conditions like diabetes and high blood pressure as you age. Really, what I typically tell people to do, be mindful of the things that you're eating. Okay. Big tripping points can be extra added salt and sugar, which happens during the processing of foods. I don't think people realize that a lot of that extra salt that ends up in your food doesn't come from the salt shaker, but rather comes from the process of the processing of the food. Okay. So if you stick to that outer ring in the grocery store when you go shopping, that's where more of those fresh fruit foods are going to be stored, things that aren't as processed. As we age, we tend to develop, even, because of genetics, but despite our best efforts, some of those chronic medical conditions. And typically the things that end up happening, aside from trying to control lifestyle, diet, exercise, controlling and managing so you're at a healthy weight, will add medications to help control those issues. So you want to be mindful of the potential side effects of your medications and ask your doctor what those might be if you're not sure. Also, very important to correctly follow the instructions your doctor gives you about how to take those medications. So really, there are a lot of things that we can do ourselves and with the aid of modern medicine to keep those risks in control. So definitely keeping up on your own personal care, managing stress as well, very important. We just recently over the last year had a little bit of a change in one of the very important screenings that we recommend, and that's colon cancer screening. Okay, it used to be we'd recommend a colonoscopy or alternative screening like Cologuard right around the age of 50. That actually got dialed back for both women and men to 45. Getting the appropriate amount of cardiovascular exercise is incredibly important. Okay, and when I talk about cardiovascular exercise, I really mean getting that heart rate elevated for 30 minutes. Another thing to definitely do is make sure that in addition to the cardiovascular exercise, which would be things like walking, swimming, bicycling, you're also getting a good amount of weight-bearing exercise. So that can help to slow down the process of bone loss and prevent osteoporosis as you move forward with your life.
And for more information, you can head over to avera.org/medicalminute. We'll be right back.